You would just check it in like any other drug that we would take.
Okay, and the second one I would like to ask is, would you talk a little bit about what to do if you approach someone who is in need of that Narcan? Because you have to be very careful about touching things at that point too.
Now, would you mind repeating the question for us, Liz?
Yes, what should you do if you run up on a person that is in, yes, distress or process of overdosing, as far as knowing, grab gloves if you can, that kind of thing, because if you touch that fentanyl, you may have to have it yourself.
Did you get that?
Yeah.
Okay.
Yeah, so thank you for your question. Again, the recommended response if you're encountering someone and you suspect they're having an overdose is to, of course, call 911. If they are in need of Narcan, to administer it. That point about fentanyl being potent and is their concern for the individual administering Narcan that they could then have an overdose themselves. I think the reality is that in most situations where Narcan is being administered by a community member, they're not going to have gloves that they can put on to protect themselves, right? And so the recommendation is still to administer Narcan and to know that the risk, and Dr. Pope or someone else would like to jump in as well, would be minimal in a situation like that, where you would have an overdose simply by administering Narcan to another person.
And just being aware of the surroundings when you are looking or evaluating the patient when you get there, not the patient, it'll be an individual. But most times they'll be incapacitated with an overdose. So you want to make sure they're, laying flat, they're not vomiting, pretty much doing your CPR, if you're CPR trained, doing your CPR protocols. Of course, like Dr. Jones said, you're not going to have a sink to wash your hands immediately. Most times people don't have gloves. There are things that you can get on Amazon or other sites where it's like a little key ring and it has a CPR shield for the mouth, as well as a small thing of gloves that you can hook on your key ring. So that may be something you might want to just have, especially if you know that you may be in an area of that nature. But the Narcan is given via the nose. So usually that area may be not as contaminated for you to touch it, but you will hold the Narcan injector here into the nose, and you can attempt to try not to touch any area around. But like Dr. Jones said, make sure 911 is being called so they can take over after it's been administered. And then, of course, you make sure you go immediately to wash your hands